Good morning, Irene Leithhead. Good morning.
Good morning, Gloria.
The month of April, and apparently we're going to be talking about April Falls, not April Fools, but April Falls. In other words, what happens when older people have falls and things like that. So I guess we want to focus on the prevention of falls for older people. Can you tell our listeners a little bit about that, please, Irene?
So the reason why April is April Falls Month is the New South Wales Government has a group called the Clinical Excellence Commission, and they do research into a number of issues that are important in health in New South Wales. And falls is important because nothing costs more to the New South Wales health system than falls. So 27,000 people are hospitalised each year because of falls.
Really?
400 people die a year from a fall. And the thing that's important for older people is that more than 1 in 3 people over 65 fall once a year. So
That's staggering. That's staggering. But then, look, it's so easy. I had a fall the other week, and it was just, I don't even know how it happened. But, you know, it just goes to prove that sometimes you can just be walking, you can trip on the road, or your foot can catch on something, and before you know it, down you go and you tumble. And, of course, as we get older, sadly, the falls have a much greater impact on the body.
Yes, they do have a much greater impact, and they are more common. The fall you talked about, Gloria, I don't know how old you are, but everybody falls over when there's a hazard. So if the ground is slippery or there's something to trip or the conditions that we're walking in change. But it gets a bit more complicated as we get older. But the encouraging thing is there's extensive research that demonstrates that many falls among older people can be prevented. And so there's a number of things that if you're living at home and you're worried about falling, that you should be thinking of. And the first thing is, what's the environment like that you live in at home? And so is it safe? Are there hazards that you can fall over?
Of course, yeah.
Yeah, so common things are rugs and leads, electrical leads. And unfortunately, if you've got a bit of a wild pet, a pet can actually be a falling risk.
It can too,
so,
yes.
So you just need to be aware of those. And don't forget outside, you know, are your paths safe? Are your steps manageable?
Well, that's right. There's so many factors, isn't it, that become occupational health and safety. And I'm speaking with Irene Leithhead from the Incadine Physio of the Moran Group. We need to also be aware that, as you say, living at home, what can we do to reduce the risk of people falling? And if we can help people like, you know, okay, you've got sons, daughters, nieces, nephews that may be sort of carers for their family members, and they're concerned about their family's mobility. What can they do to assist in helping them from falling?
If we go to the things that I'm passionate about, which is the mobility and your physical health,
yes.
If you want to live independently in the community and be able to do the normal things that a person who lives at home independently does, you need to be able to walk on a variety of surfaces. You need to be able to negotiate stairs. You need to be able to get in and out of your chair easily. And you need to be able to walk at a reasonable speed. That doesn't mean you can't live independently in community if you can't do all those things. But if you're not able to do those things, you may need some help.
Right.
And that's not a bad thing. Australian government is very keen for you to stay at home and to live as independently as you can. So if someone was noticing that their parent was having trouble getting up and down the stairs at home, or getting in and out of the car, or was slowing down with their walking speed, then there's an excellent website called the My Aged Care website where they can call up and chat to a consultant, and maybe that relative needs an aged care assessment for some extra help at home.
Irene, thank you very much for taking time out of your very busy schedule today to talk to us, and I hope that we may be able to continue sort of doing regular discussions with Moran Healthcare on a regular basis. So
that would be fantastic.
You know, so I will be communicating with you and Anne regarding more and more updates that we need to bring to the people, and I'd like to thank you for your time. And, of course, Moran Healthcare are proud sponsors of 2SSR 99.7 FM. So thank you once again, Irene, and enjoy your day.
Thanks very much for speaking with me, Gloria.
My pleasure.